Welcome to yet another Beyond the Blue chat. Today, I am thrilled to have with me my colleague and friend and occupational therapist, Priyanka Gupta. Priyanka is an occupational therapist. Like I said, she works with families and children with developmental delays and disabilities in Mumbai for the past 9 years. Her expertise is in working collaboratively with families to achieve maximum independence and positive participation for children in daily occupations that are important to them, not only at home, but at school and within the community as well. And I'm really, really thrilled to have her here. Welcome, Priyanka.
Thank you, Gopika. Thank you for having me. I'm really thrilled to be here too.
Okay, superb. So today we are going to be talking about something and which Priyanka is done a lot of work, right, Priyanka? Which a lot of occupational therapists work on routinely, which is toilet training. And we are specifically going to be talking about how to train children on the spectrum successfully in toilet training. We are also going to be talking about something later, which very few people talk about because it's regarded as almost a taboo topic, which is fecal smearing. So, Priyanka, let's talk about toilet training first. It is such a huge, huge issue, not just for parents of kids on the spectrum, but also for neurotypical kids as well. And yet, there are a lot of mistakes that parents make during this. I know that when my kids were younger, I really struggled to get this whole get a hang on toilet training, and there are a lot of mistakes I'm sure I also must have made. So, what are these common mistakes that you've seen parents make while toilet training their kids?
Yeah. So, Gopika, as you correctly said, firstly, I want to acknowledge for parents that toilet training is hard, not only for children on the spectrum, but for neurotypical children as well. It's some children will achieve it without any hiccups whatsoever, which also happens for some children on the spectrum that they will just be toilet trained even before they've learned other skills. But for some children, they will continue to, struggle with it, not just when they are 2 or 3 or 4, but beyond that as well. Sometimes when they are 8 or 9 or 10, also there will be skills that we see that are missing even when the child is older. Right. So one thing I want to say is, yes, it's difficult. It's also difficult for parents of children with, who are neurotypical. I would not say, so there are some things which do get overlooked when we are working on toilet training, like coming back to your question about mistakes. So I would say that there are some things which we tend to overlook. Even the parents or even the therapists may, overlook some things which can again be detrimental when we are working on toilet training. So one of the main, one thing that I want to bring up, like I said, which people can commonly overlook is the issue with interoception. Now, what is this interoception? I mean, a lot of people already do know about it, but for those who are unaware, so interoception is sort of like our eighth sense. We commonly talk about 7 senses of our sensory system, and people know those a lot better. But this is like our 8th sense. It gives us internal body cues. Now, say for example, what do you feel when you're hungry? What sensations do you get from your stomach?
So you will feel like the clenching of the stomach. You might feel like dryness.
Dryness.
Like that thinking. Maybe the mind is always thinking about food, saliva in the mouth, right? I mean, I guess typically when you
exactly. Absolutely. So this is your interoception. The fact that you're picking up all these cues is that you're using interoception to tell you that you are hungry. Right. Now, none of the cues that you described are, it's not a straight line that directs you straight to hunger. Right. But that is your experience that has taught you over years to know that this is how my body feels when I get hungry, and then you obviously go on to eat. Right. Similarly, when you're thirsty, you could feel a dryness in your throat, like you said, or a dryness in your mouth, or different sensations in your body, which will, guide you to that. Now, taking those examples, also this plays a big role in our emotional regulation, knowing how our body feels when we are starting to get anxious, starting to get angry, for example.
Yes, exactly.
We also do experience certain body sensations before we actually realize that we have felt that emotion. So that's also part of interoception.
Okay.
And now, how does this relate to toilet training? So, again, the feeling of having a fullness in your bladder
Right.
or your bowel,
Right.
and recognizing that I need to go. Now it's the time that, I need to go, and recognize it as the right time, not when it's already too late, so this is a major issue for many children on the spectrum, and very easy to overlook, because there is nothing on, the face of the child or outside that can actually tell you or guide you about this.
Okay. Why is
Yeah.
this? Why is this the case with a lot of kids on the spectrum?
See, again, this is part of their sensory processing difficulties. Okay,
Okay.
so like we commonly know about children who have vestibular processing issues or touch processing issues. This is also part of sensory system dysfunction, the
Okay.
processing dysfunction. So this also can simultaneously co-occur, and many times it does. But like I said, unfortunately, it's not discussed enough, or it can be very easily overlooked.
Absolutely. I mean, I worked all these
Yeah,
years with kids, and I knew vaguely about this, but I didn't really
yeah,
know that it's something which has a term, and that this is what it's all about.
yeah, yeah. So often I'll tell you, the challenge with this is, you may have a child who's having a lot of accidents even during the toilet training process,
Okay.
is wetting themselves a lot. Or sometimes you may see older children who you worked on for years with toilet training, and they still rush at the last minute, when it's
Right.
absolutely, they may not have an accident, but they are rushing at that very
Rushing.
last
Yeah.
minute when they have to go. That also can tell us about something about problems with interoception, that they don't get it until it's that full, and then they need to rush. So the reason I'm bringing this up is, one, so that when we work with children, we have some empathy for this issue and empathy for the child, that it's not always the child just being difficult or not getting what we are doing, but it's also something internally that's
Right.
happening, that's not working for them. Okay,
Yeah.
like their body is not supporting them in that process, basically. So this just helps to have empathy even for an older child, maybe a 10-year-old or a 12-year-old who's rushing at the last minute. And we may think, oh my god, like so many years, and you're still doing this, why don't you just get it? But
Yeah.
they don't get it.
And there's so much shame and embarrassment
Yes,
with the parents associate, with something like
yes.
this, especially for older kids,
Absolutely,
which is so
especially for
difficult.
older kids. Yeah, so it reduces the child's self-esteem a lot,
Yeah.
because they may be asked often that, why can't you just go on time,
Right.
or why can't
Yeah.
you
Yeah.
just
Yeah.
remember to go? So these things again can become very anxiety provoking, whereas the issue is much deeper. It's not just them understanding and going at the right time. It
Right.
just doesn't work. And that's why, if we overlook this and just do our scheduling and rewards, they may not work that well, or you may get like you may get like 20-30% success and not good enough results, because we overlooked this.
Okay.
So this is something to think about and talk about when we are working with toiletry. Now, moving on, so going ahead with this, so just because I've already brought it up, I'll share a few things that are important to also consider. I don't want to leave it hanging there.
Yes.
So one thing that's important to do is to work with your OT to develop a good plan, just for teaching the child better self-regulation, and using sensory integration techniques to
Okay.
just make, so something known as a body brain connection. Okay, so just knowing that my body, what does it feel and what does it do for me, and what is the end result of that, what do I feel in my body and what's the end result.
Okay.
So, but of course these plans need to be individualized. So I'll share an example with you. So I'll just share one. It's just a small thing, it's not everything, and it will not work for every child, but it's just something that I did
Okay.
for one child. You will have to enable screen sharing with me.
Okay.
Sorry.
Sure.
Yeah.
Sure. Just a minute. Give me a minute. Okay. Okay. Should be okay now.
Yeah.
Okay.
Okay. So I'll just show you a little something that I did for one child that I was working with. Yeah. Are you able to see my screen?
No, it just says that you started sharing screen.
Okay. Maybe it will show.
Oh, superb. Okay. Yeah, I
Yeah.
can see that.
So Yeah. So if you look here, what we've done is I need to use, this is a social story, okay, that I've used with one child.
Yeah.
So I need to use the toilet. This is for school actually. So what we've done is I've said I need to use the toilet in school as soon as I feel some pressure, and we've shown where he may feel that pressure,
Okay.
in his which
Okay.
area. I must not wait too long or my pants will get wet. So this is something that would happen at school, is he
Right.
would wait till the last minute or be busy with classwork and miss out on the cue of actually using the toilet. So this is again the introspection piece. But just putting it in the social story also will not work. So we did sessions with him where we spoke about what it feels like. I had mom use a small ball and gently press on his stomach, and on the lower part of the abdomen, actually not on the stomach, on the lower part. So for him to know that even a little pressure can be a
Right.
signal to want to go, and a lot is not a good time to run, basically. So he started recognizing this, what I said about feel some pressure. So
Okay.
that was made like physically possible for him to know what does that feel like, okay,
Okay.
in my body. But we did this before we put the social story, so he could
Okay.
relate.
Right.
Yeah. So
Okay.
I'll stop the share, basically. So this is just a few examples of how we can start thinking about introspection when we are working on toilet training.
Okay.
So that's just one thing. Now, moving ahead, again going ahead, like as we come back to our question of things that we can overlook or mistakes that we may make, another thing that we begin toilet training and I want to talk about is constipation, which is again such a big issue with kids on the
Yes,
spectrum.
I know a lot of them.
Yeah,
Exactly.
a lot of them. Yeah. So constipation is one big issue, and if we know that the child is constipated, and the therapist can obviously figure that out only when they talk to the caregivers, in detail. uh, that is something to work on preferably before you start training your child,
Okay.
okay, because if we start training while the child still has issues with constipation, and if the process of toilet training is not a fun or a favorable one for the child, everything becomes a negative association and the child can resist the whole process. They
And
can
it
even
becomes so
start
stressful, right? I mean, it's
stressful.
because the parent is stressed, then the stress
Exactly.
transfers to the child, and just becomes a very negative kind of
Exactly.
experience.
Yes, yes. So absolutely right. So that is one thing that we want to work on first, is that whole anxiety aspect for the parent and for the child. So often I will ask caregivers, that how do you feel about going into toilet training, and sometimes they will say, oh, we feel very anxious because we think he's not going to cooperate. That's when you know that there is a big piece that you have to address before you
Right.
give them actual strategies or
Yes.
actually start the whole process. And some will say, yeah, he cooperates, I've taken him so many times and he's happy to go, he's happy to sit, though he's still in his diaper. Then you know that okay, that's not so much of an issue for this
Right.
parent. So
Right.
it's important to have those conversations and figure out. So constipation is something that I would always ask about. This also actually affects training for peeing, not only for pooping as people would
Okay.
commonly know it. Because when a child is constipated, it can press on their bladder
Bladder.
and
Right.
also just increase their, urinary frequency, or it can lead to irritation of their bladder. Basically, it doesn't work well for toilet training for pee or poop, both of them. Okay. So again, now the best way to work on it is to work with your pediatrician, to get the right laxatives or whatever the pediatrician suggests for this issue, which will first solve it, and then go ahead with toilet training.
Okay. Okay. Okay.
So
So that,
yeah,
yeah, absolutely. And also, I guess to pay attention to the child's diet also is something important. Make
absolutely.
sure there's enough
Yeah.
fiber and
Yes.
kind of roughage that the child is getting, so that
Yeah. Yes.
they're able to.
So yeah, so it's interesting you mentioned fiber, and this is something that I usually do discuss with families. That is the first thing they will increase in the child's diet when the child
Okay.
is constipated. But if your child is low tone, if your OT has spoken to you about that, and if
Okay.
your child has a generalized low tone in the body, then increasing fiber can make pooping more difficult rather than less
Oh,
difficult.
okay. That's interesting.
Okay.
I didn't know that.
Yeah. Yes.
Okay.
So Yeah, so these are just, like I told you, these are just some things that we do tend to overlook and follow advice. So a better approach would be to increase fluid intake rather than fiber intake, and
Okay,
keep fiber normal. I'm not telling you to decrease fiber, but
right.
I'm saying that keep it normal, like how any other child could be taking in fiber at their everyday requirement. Keep it at that, basically,
Okay,
and work on fluid intake instead. That
okay,
would be much better.
okay. That's
Yeah.
a good thing to know.
Yes.
But okay, so
Yeah.
I have two questions, and you can answer them one after the other. So one is when you showed me, you showed everyone the social story, and there is this
Yeah.
child who's able to understand pressure, and of course you actually showed pressure and stuff like that. So this
Yeah.
is a child whose cognitive level is such that they can absorb social stories,
Yeah.
they can understand the meaning of pressure, they can tolerate that feeling of the ball on their stomach. What do you
Yes.
do with a child who is not able to do all these things? That is my
Yeah.
first question. And the
Hmm.
second question is, so I presume this child was younger, but again, we talked right at the beginning
This
about
child is
older.
6, just
Okay,
to give
six.
you
Okay,
yeah, he's
okay. So
6.
the child is
Hmm.
6. But when you have an older child, and I'm talking about a
Hmm.
much older child, a child who's 14, who's 16, who's 18, who's not a child
Yeah.
anymore. I mean, then they're an
Right.
adult, right? So
Absolutely.
how,
Yeah.
and it's very difficult for the parents, because along with the child, the parents are also becoming older. And to take
Absolutely.
care of things like toileting is very, very
Yeah.
difficult. So how,
Yes.
and they're still not independent. So I want to
Yeah.
ask you about these two things. One is about the child of the level where the child can understand all these things and tolerate all these things, and the second is in terms of older kids. So can you tell us about both those?
Yeah, so taking your first question about children who cannot understand, so much of working about interoception or language about interoception or even the social stories, one thing that will definitely work, like I told you, is working just on them, being able to be better self-regulated through the day by using, an individualized plan for sensory integration for them. What do they need? So, do they need vestibular, proprioceptive, tactile inputs?
And
Are
of
they,
course, can you just explain just briefly those two terms, because I know I always used to get confused between the two.
yeah, yeah. So vestibular is knowing your body's position in space. Basically, it can help you with balance. It can help you with movement, to have those effectively. And proprioception is knowing our joint position, where our, say for example, knowing how my leg is placed right now. Is it bent? Is it straight? So I get that information from my joints,
Okay,
which tells me my body's position. It
okay,
increases my awareness about my body. So as you can see, these do have major components for, understanding body signals as well, which is why working on this from a young age with the child is going to be beneficial, for a child who you cannot do the kind of things that I showed, or, cannot work in that much detail or at a cognitive level.
okay,
So these will be better because the child will be better self-regulated. Another thing is, sometimes something like an external aid can also help. So one example is having a vibrating pillow on the child's lap can help relax their muscles and help them to just go in the, to pee or
okay,
poop faster in the toilet. So these are, then we would start looking at something externally that can help them to get, muscle relaxation or be able to achieve that without actually teaching them too much, because they may not be ready to learn that.
okay.
Okay. So, but of course, like I said, that has to be individualized for the child. So that's one thing. The second is also doing some blowing, with the child. So in the bathroom, when the child is on the commode, if he is able to do blowing, if he can blow bubbles or do some deep breathing, that also helps to relax their body, and then they can have,
Okay,
a bowel movement or
okay,
actually. So these are things, but of course, like I said, now this will this will also have to be
right.
individualized for what
Okay,
works for that child when you can't do cognitive strategies.
okay, okay.
Yeah. And uh, and yeah, your second question about older children. So see, it's absolutely right that when the child is older and has not picked up these things yet, and you correctly said that parents are also older
Yeah,
by then, again, in that stage, sometimes we may need to rely on external supports in
Okay.
terms of what works for that child. A simplest example might be for an older child is to have a watch that vibrates every 1.5 hours or 2 hours, and the child needs to just go to the toilet and use it, okay, and does not need to be told by the parent every time, or
Okay.
so something like that, an external reminder that can work, or maybe it's put into their visual schedule, for example, for an older
Okay.
child, so they know that this is a recurring event. When do I go? Yeah, so that is also something that can be done. Again, with older children, I would say, this is not the only thing. There are a lot of other issues also, which we can talk about, so something like, for an older child to know that I have to wear my clothes before I step out after using the toilet. That's something many times when I see an older kid, parents will tell me that he just walks out without, clothes on because he's taking them off before using the toilet, or she does not know what to do when her clothes are off, and then she has a tough time managing putting them back. So these are again points that will need to be considered with older children and will need to be taught, for successful toilet training, basically.
And what about an older person who cannot clean themselves after toileting?
Yeah,
How does
yeah,
can they be taught even at an older
yes.
age?
Absolutely. So, teaching for any skill can happen at any age. That is something that I want to, put it out there, that just because, say, a child is older, say even 20 or 22, maybe, whatever, and if they do not have a particular skill or it's missing, that does not mean that the skill cannot be taught. Now, what is the reason that the child still can't do it at that age is important to investigate first.
Right.
Okay. Is
Right.
it that sometimes caregivers have just been doing it because they feel that the child will not do a good enough job of it? Okay, but only when you investigate, you will find that out. So
Okay.
they may tell you that, he's not going to clean it well, or she's not going to clean herself well enough. So we just do it to ensure that she's, clean.
And
So that's where
sometimes
you
I
have
guess it's just that there's one more thing to teach, and they just
to
couldn't be
teach.
bothered. It's just like, let me just finish it
Absolutely.
off and get it on with, get on with my day.
Absolutely. Yeah, absolutely. So sometimes investigating what is the reason, or always investigating what is the reason that the skill is not there. Is it that the child has a physical issue along with that? Maybe they do not understand the motor planning needed to achieve that. So then again, that will have to be broken down and taught in a way that the child can understand. Like you said, the caregivers may be burnt out and may not have the
Right.
bandwidth to teach one more thing,
Yes.
which is why they just continue to do it for the child and do it for the adult, and
Yes.
not teach. So the reasons are important, and what the reasons are will help us to reach, a conclusion. Sometimes modifications in the environment may also be needed. So say, for example, a hand shower might be easier for some adults rather than using a mug and water, which is commonly used in Indian
Yes.
homes. So, sometimes a hand shower might be more easier to use and to teach with. For some children, maybe they don't tolerate water and it's a very unpleasant experience, in which case wipes or
Yes.
toilet paper might be a better option because drier sensations are more tolerable to them in that area. Now, all of this will need to be investigated, and a suitable plan will have to be put into place. So that's what I would say for older kids, is that again, investigating is important, and it's never a one size fits all approach.
Yes, that's very true. That's really true.
Yeah,
So now I'd like to ask you about fecal smearing. This is something which I think a lot of parents, even
yeah,
reading about it or hearing about it, there's a lot of fear, there is a lot of revulsion. And so, firstly, can you tell me what it is and why it happens? Can you
yeah.
explain it very simply?
Yeah, sure. So, often the history will sound something like that. So, caregivers will say something like, the child is touching their poop, is smearing it on the walls, on the bed, or on their clothes. Sometimes children will put it on their face. Sometimes it's not their own. Maybe they're taking it from a sibling's diaper when the
Hmm?
sibling is being changed, for example. So, parents will report this. Often, one thing I would like to say here is that parents may not report this because they may find it a very, embarrassing behavior or not something fun for them to talk about at all, even though it's a challenge.
Yeah.
And I want to acknowledge that it is a difficult behavior to work on and just to deal with, on a day-to-day basis if it happens frequently in the child.
True.
So this is what we may hear the caregiver, share their concerns about. Is the child touching their food, smearing it, or putting it on surfaces? So that is what typically the behavior is, Yeah.
Right.
Yes.
And why does it happen?
Yeah. So the commonest reason again here, which again, this is something that can be overlooked and where usually for many children, not for every child, but for many children where fecal smearing starts from is again constipation or some other issues with their bowel movements. Okay.
Right.
So initially there might be a discomfort, associated with using the toilet, or they may have, poop stuck there, or some discomfort or
I
uncomfortable.
remember some of the kids I worked with had piles, like I told you when we were
Yes,
speaking, that they had piles,
absolutely.
and it was just a way
Discomfort.
to kind of touch that area and kind of make
Yes,
sure that it was okay, and that's
yes.
how it all started.
Absolutely. So typically we'll see this with children again, not always, but many times with children who don't have communication skills that are, useful
Right.
enough for them to share with the parent that, this is what is happening and
Okay.
I don't feel good, I feel uncomfortable, or I need to see a doctor that's not there.
And is it
And they
more
may
in
start
kids who are constipated? Have you seen that?
it is, so like I said, usually this is even from my experience and what I've read about smearing is that typically the child will have a, issue with constipation also, and that's where usually it starts from, because they start first touching and exploring the area because they may have pain,
Right.
discomfort, or just not feel good through the day because of that, because of not having good bowel movements through the
Right.
day. So this may happen, and sometimes the child may just start off by getting it on their hands and biting it here or there, and that may lead to, it can become a behavior. Sometimes it can also become that they get that on, they get the poop on their hands and they enjoy it from a sensory perspective. Okay, so if the child is a sensory seeker, they may actually like the texture of it on their hands. If they
Okay.
enjoy messy play, typically that may happen with the child, that they may end up smearing it just for play or fun. They may smell it. So caregivers will give this history that, they touch and then they smell. So clearly they are not being, they are not repulsed by it, but they are
Yeah.
seeking it out,
And then the
So
attention they must be getting after that.
yeah, so absolutely. So that is I can't help but mention that as well, is
Yeah.
that when that behavior happens and when it starts for the first time, it's impossible for caregivers to not give a
Yeah.
strong reaction.
Okay.
Everybody would. It's normal, and that will happen, that you may give a strong reaction, you may scream, or you may yell, or you may say something loudly, and that gives the behavior immediate attention. It can be a factor that can perpetuate the behavior then, and
Right.
be an added factor.
Yeah. Yeah.
Additionally, I want to add two more things, which, like you mentioned, that it can get attention and keep it going. There are a few other things which can keep the behavior going also. Like sometimes the fecal smearing may be followed by a favorable activity. Like sometimes parents may start a very fun bubble bath for the child, okay,
Right. Right.
and the child may really enjoy that. Or they may, start the TV while they are cleaning the child just to keep him
Child. Yeah.
distracted
Yeah.
or busy. So
Right.
what happens is that there's a connection that it's also followed by fun stuff, and it's just kind of a fun environment to do it in. It creates fun for me. So
Right.
again, it may perpetuate the behavior. Again, this is not a, it's not that it happens for every child this way, but it's worthwhile to keep in mind and to, assess these things, that what really happens after the episode. Another thing, one more thing which is worthwhile keeping in mind for some children, they may do the fecal smearing only in certain situations or with certain adults. So it may be to escape from that situation if something is not working out for them.
Right.
Then in that yeah, then in that case, of course, I will work, with the caregivers to help them to see what is not working out for the child in that situation or with the particular adult, rather than working on the fecal smearing itself, because it's probably an escape behavior more than anything else.
Okay, okay,
So
okay,
yeah,
okay, great. Okay, so
yeah,
I guess it's something which can be dealt with and can be dealt with in very strategic ways, and
yeah,
definitely that's good for parents to know. Priyanka, any
yeah.
last kind of um, you know knowledge that you want to share with parents about toilet training, about fecal smearing, anything that you want to share about what they should keep in mind when they
Yeah.
embark on this journey?
Yeah. So just a few, one thing for fecal smearing, which I already mentioned, and I want to say is that it is a very stressful behavior. It can be very, very exhausting for parents to deal with. Sometimes when they do a lot of thorough cleaning, they can still have unpleasant smells in the house, and that can really be,
Right,
that can really put them off. So for that, I would say do not think twice before talking about this to your pediatrician or therapist, and getting support as soon as possible rather than later. So that is something that I would want to say, is that speak about it without a fear of any kind of judgment or anything, and get the support sooner rather than later.
okay,
The other thing that I would say for toilet training, like you mentioned, it really is a journey.
yeah,
Just getting the child off diapers is not toilet training. It's only when the child can actually manage the skills, the way, other people around them, maybe adults around them, their caregivers are managing. That's when you know the child is toilet trained. So
right.
things like, so like I said, things like knowing that this is a private act, I have to close the doors, I have to not let anybody be there with me.
There's so much
How do I
more to it.
manage? There's so much more to it, basically. How do I manage my clothing, that I don't come out, before I'm dressed? For girls, later on, managing their menstruation along with the toilet training. So, like I said, this just doesn't end with, so we can't say that a child is toilet trained once he's off his diaper. That's just the tip of the iceberg,
Right,
basically.
right.
So, yeah.
Okay, great. Thank you so much, Priyanka. Thank you for being part of this.
Okay.
I learned a
Thank
lot of
you.
things today. So
Thank you,
thank you
Gopika.
so much. And I really, really think it's going to help a lot of parents.
Okay. Thank you so much.